With the state of Kansas beginning to open back up, Dr. Robert Freelove, Chief Medical Officer, joins me to talk about what Salina Regional Health Center is doing to continue to provide safe health care. Well, Dr. Freelove, thank you so much for being on the show. I wanted to have you on now that the state restrictions are starting to be lifted to kind of look at that as what it means from a medical standpoint.
Sure, happy to be here. I guess what it means is that we've been successful in flattening the curve. The stay-at-home order, all the social interventions that we put into place, those things have helped flatten that curve and slow the spread of the disease to allow our hospital and other hospitals to better prepare in case there's a surge later. I think probably more importantly than what it means is what it doesn't mean. And it doesn't mean that people should just run out of their houses and start hugging strangers. We still need to be smart about what we're doing. There are still some restrictions in place. It's a phased reopening.
Talking about the restrictions, let's switch our focus to Salina Regional Health Center.
Sure.
And our restrictions we have there and what that means and what that entails and what some of those restrictions are.
Sure. Yeah, we've put over the last several weeks, we've kind of had an escalating number of restrictions on visitors and what we're doing here. And really it's all been in an effort to maintain a safe environment for everybody to get their health care, both for our patients and for our employees and for the community. So some of the things that we're still doing, we're still having no visitor policy here at the hospital. We're screening everybody. In fact, we screen people before they get here. On the phone when they're scheduling, we screen them for symptoms or risks of exposure. When they get here, they get screened again at the door, plus we're checking temperatures now. We're doing the same with employees. Everybody self-screens every day. We're checking temperatures of employees every day. And we're doing some things to try and move the care of people who have respiratory symptoms to single locations so that we can minimize that risk of exposure in our other locations. So we have a lot of things in place that make it safe for people to go get their health care, and I'm hopeful that people get out and address their other healthcare needs, especially now that things are starting to open back up.
Do you think going forward, society's going to learn something from this?
I'm hopeful that we have. I mean, if nothing else, I hope everybody understands the importance of good hand hygiene, of washing your hands and keeping your hands clean, not touching your face. I mean, we've seen a dramatic decrease in the number of influenza cases.
Right.
Usually it's a slow taper at the end of the flu season, and it just went phew. Right. And I'm sure it was because of all those interventions. So I'm hopeful that some of those things stick, especially during those seasons of the year where there are diseases or things that are being spread around like influenza. Just wash your hands, keep social distance, be smart about what you're doing. I'm hopeful that society learns that lesson out of this.
I hope so too. Thank you so much for being on the show. Thank you for watching. For more information, please visit srhc.com, like us on Facebook, follow us on Twitter and Instagram.